Hey, welcome. There's a really good chance you've taken the antibiotic we're talking about today. Maybe you know it by a brand name, like Bactrim or Septra. It's a total workhorse in medicine, a real powerhouse against infections. But here's the thing, it's also a double-edged sword, and it's so important to understand both sides of it.
All right, so here's our game plan. We're going to look at what makes this classic combo work so well. Then we'll get into its really clever two-step takedown of bacteria. We'll check out its hit list, what it's used for, and then we'll dive into the really crucial stuff, the serious side effects and dangerous drug interactions you absolutely have to know about. Okay, so what is this stuff exactly? Well, for decades, it's been this super reliable tool for doctors taking on all sorts of bacterial enemies. It's what we call a broad-spectrum antibiotic, and that just means it's not a one-trick pony. It's a versatile fighter that can handle a whole range of different bacteria. The real secret sauce here is that it's not actually one drug. It's a strategic team-up of two. You've got Sulfamethoxazole, which is a classic sulfa drug, and then you've got Trimethoprim. Think of them as a dynamic duo. Each one has its own specific job, and by working together, they create this incredibly powerful one-two punch.
So, how does this team-up turn into such a potent bacteria-killing machine? It's pretty fascinating, actually. The way these two work together is just a perfect example of teamwork at the molecular level.
The magic word here is synergy. It's this idea that the combined effect is way greater than the sum of its parts. It's that whole 1 + 1 = 3 kind of thing. And it's this synergistic power that makes this antibiotic so incredibly effective. So here's the brilliant strategy. See, bacteria need folic acid to build their DNA and basically to live. This drug combo attacks their folic acid production line with this devastating one-two punch. First, the sulfamethoxazole comes in and blocks an early step. Then, right when the bacteria are scrambling to figure out a workaround, boom, trimethoprim hits them at the very next step. It completely shuts down their whole operation.
And this is the key point right here. This combo doesn't just slow the bacteria down or stop them from multiplying. No, it's what we call bactericidal, which is just a fancy way of saying it actively kills them. It's a total knockout blow.
All right, so we know how it works, it's magic. But what infections is it actually used for? Well, its hit list is pretty impressive. Okay, number one target. If this drug is famous for one thing, it's for treating urinary tract infections, UTIs. For a long time, it's been the go-to choice for those uncomplicated cases, especially the ones caused by the usual suspect, E. coli.
But it's definitely not a one-trick pony. Its range is pretty amazing. It's also used to fight nasty skin infections like community-acquired MRSA, a really serious type of pneumonia that can hit people with weakened immune systems, flare-ups of chronic bronchitis, and even some less common but serious infections like toxoplasmosis and nocardia.
Okay, now we need to flip the point over and look at the other edge of the sword. Because for all its power, this antibiotic has some very real, very serious risks. And it's so important that you know what they are. Let's get right to the most serious one. In rare cases, this drug can cause absolutely devastating, life-threatening skin reactions. The most famous one is called Stevens-Johnson syndrome. The takeaway here could not be more simple. If you get any kind of serious, widespread rash while you're on this medicine, that is a medical emergency. You stop taking it and you get help right away. All right, next up, potassium. The trimethoprim part of the duo can actually make your body hold on to potassium, and that can lead to dangerously high levels in your blood. It's a condition called hyperkalemia. This is a big deal because it can seriously mess with your heart rhythm. Remember how it messes with the bacteria's folic acid? Well, sometimes it can have a small effect on our own cells too. This can lead to a drop in your blood cell counts, things like anemia or low platelets. This is something to really watch for, especially if you're taking the drug for a long period of time. So, who really needs to be careful here? Well, the risk of those bad skin reactions is actually higher in patients with AIDS. That high potassium problem? That's a huge concern for the elderly, for people with kidney issues, and for anyone taking those super common blood pressure meds, like ACE inhibitors or ARBs. And the blood issues are more likely in people who already have a folate deficiency. And there are a few other really critical warnings. You absolutely do not use it in the first trimester or near the very end of a pregnancy. It can also be a big problem for people with a specific genetic condition called G6PD deficiency because it can cause serious anemia.
And super important, since your kidneys are what clear this drug out, the dose has to be cut way down for anyone whose kidneys aren't 100%.
Okay, we're almost there. But the risks don't just stop with the side effects of the drug itself. We have to talk about how it plays, or rather doesn't play, with other common medications, because some of these mixes can be seriously dangerous.
Listen up. If you or someone you care about is taking any other prescription meds, you really need to pay close attention to this next part. This isn't just good to know information. This is absolutely essential for your safety.
So check this out. These are some of the biggest problem combos. If you're on the blood thinner warfarin, this antibiotic can ramp up its effect, which means a much higher risk of bleeding. Taking it with methotrexate, a drug for things like rheumatoid arthritis, can lead to some really bad toxicity. We already talked about ACE inhibitors for blood pressure. Well, the exact same danger applies to ARBs, another common blood pressure med. The mix can send your potassium levels sky high. And with an old seizure med like phenytoin, it can boost its levels into the toxic range. With all of these, the only safe way forward is super close monitoring or, honestly, just avoiding the combination altogether if you can.
So there you have it. It's a brilliant, powerful weapon against infection. A true medical classic. But, as we've seen, it's also a double-edged sword that really demands respect and knowledge, from both the doctor prescribing it and the patient taking it. Which really just leaves me with one final question for you to think about. Do you really know the full story of the medicines you take?